You may recall a few weeks back we talked about this 10-day challenge. The 10-day challenge was really an opportunity to set a goal that at the time didn't appear achievable, but in the process of pursuing it, we would develop a greater understanding of what the challenges were, what the issues were as it relates to accelerating that last mile, that last inch perhaps, but that last mile in particular as it relates to the administration of vaccines. Over the course of that period of time, we recognized the opportunity to simplify our eligibility framework. You've heard a little bit about that with the 65-plus cohort that we have advanced. We'll talk a little bit more about that in a second. We're also looking to standardize our information and data. Data has become a big issue. That has become a big challenge for us. The data lag that's led to some data that's provided nationally that did not represent the data that we have internally, meaning we're a number of days behind what the national numbers reflect in terms of the actual number of vaccines administered. And we could talk about why that's the case, and we are certainly happy to do that, but more importantly, what we're going to do about it is really our focus here today and moving forward, and frankly has been our focus for now a number of weeks. Supply being a big part of also getting to goal, and that is getting to herd immunity, getting to vaccines to everybody that wants them administered, and getting to a point where we can go back to some semblance of the new normal with all the resiliency that now resides within each and every one of us, and ultimately will reside in the state and the nation and more broadly the world post-pandemic. So we have specifically addressed the issues around simplification by, as I noted a moment ago, clarifying that we believe that the cohort 65 and over needs to be prioritized alongside healthcare workers, first responders, food and agriculture workers, and school staff and teachers. So I want to make this clear. We want to continue to provide a framework of prioritization in that cohort. 65 and over, remember, 75% of the deaths are reflected in people 65 and over. We want healthcare workers to continue, want to work through that cohort, our original tiered strategy consistent with the CDC, and continue to do what we can to vaccinate the vaccinators, our first responders, our farm workers, our critical workers on the front lines in our food delivery system, and our teachers in order to get our schools reopen, as well as our support staff that's so foundational and critical not to ever be forgotten as it relates to making schools work. This, by the way, is analogous. It's not more complicated than whenever you've been to an airport and you're about to board on an airline. They say, well, ladies and gentlemen, all first-class passengers. Well, they don't wait for every first-class passenger to be boarded before they announce all business class passengers. Accordingly, they don't wait for all business class passengers before they announce premium class and then ultimately the economy class. The point is to try to move folks to board as quickly as possible, but with prioritization. That's reflected here, 65 and over, and those cohorts that are represented. We want to, though, more importantly, as we work through this cohort, begin to transition. And you'll hear a lot more about this tomorrow in Dr. Galley's update. And so we'll happily take some questions today, but tomorrow you'll hear a lot more about the details of a strategy to transition, once we work through those cohorts represented here clearly, to an age-based eligibility, which will allow us to scale up much more quickly and get vaccines to impacted communities much more expeditiously. With the framework always on equity, we're not losing sight of any of those fundamentals, any of our values, but we realize we have got to increase throughput here. And while we are proud of the framework we put out, CDC put out, and others, we recognize it has advantages and it has disadvantages as it relates speed and efficiency. Look, I get this. This slide represents what you individually and what's represented, I assure you, in my inbox are most concerned about. When is it my turn? When is my number up? And I've got a sister, I've got a brother, I've got a pre-existing condition, I'm not 65, I'm 64, all of these questions, appropriate questions, everybody getting them here in the nation's largest state. So when is your turn? Where can I get vaccinated? When it is my turn. So what we are announcing here is a standardization information database. We announced it a few weeks ago that we were going to get it done by the end of January. We have gotten this pilot up, as we noted a few weeks back, and we'll talk about that in a moment, what the new platform is. But we have now developed, we believe it's the most comprehensive end-to-end system of its type in the United States. But again, we acknowledge it's in its pilot phase. Again, we'll talk more about that in a second. But it's a centralized system to enter vaccines that are received and administered, and it's a mechanism to fundamentally address the supporting lag, which again is very stubborn but very real. Those national numbers you see do not reflect the numbers of vaccines that have been administered.